Aortic stenosis is narrowing of the aortic valve, and the aortic valve is the valve that separates the main pumping chamber of the heart, the left ventricle, with the aorta, which is a big blood vessel coming off the heart. And all the blood that comes out of the heart goes to the aorta and it gets distributed to the rest of the body. The valve develops calcium on the leaflets, so it restricts the motion of the valve. So instead of opening up all the way freely like this, the opening becomes less and less and less to the point where it barely opens and barely closes. That causes a tremendous amount of stress on the heart. And what happens, in order for the blood to force blood out through that small opening, it has to generate pressure, and the way it does that is by getting thick. The muscle gets super thick, something called left ventricular hypertrophy. And this compensates for this narrowing for quite some time. Eventually the heart says, time out, you've got to relieve this obstruction or I'm going to fail. That's when people start developing symptoms, and they're mainly shortness of breath, chest pain, and some people have what's called syncope or pre-syncope or fainting spells. And when people develop symptoms, you really need to take care of the problem, because the survival in symptomatic patients just treated with medication alone is abysmal. About 50% will be dead within 2 years.